I'm Bill Zoghbi, President of the ACC, and I'm here with Dr. Fred Bove, ACC Past President and currently Editor-in-Chief of Axel. Dr. Bove and Dr. Minnie Walsh recently led a group that produced the ACC position statement on patient-centered care. Fred, great to have you.
Thanks, Bill.
Tell us a bit about patient-centered care. What does it mean from a practical point of view?
Well, you know, in the world of cardiology, if we take ourselves out of the hospital into the office-based practice, we're taking care of most patients that have long-term chronic disease. And long-term chronic disease really demands an interaction between the physician and the patient, or between the care team and the patient. And it involves communication with the patient, coordination of care, and most of all, patient empowerment. That is, getting the patient to understand their illness, work with the teams, make shared decision-making on the care that's being provided. And all of that, it fits into the world of patient-centered care. That is, the patient becomes part of the care team and is engaged in understanding the issues and the goals so that everything's done as a joint decision in a sense. So that's kind of what patient-centered care is. Very
good. How does technology play into this enhancing this communication or the relation between the care team and the patient?
Well, if you think about communication in particular, first of all, you know, most patients now will show up in your office with printouts from the internet on their condition, some of which is okay and some of which is not accurate. And part of life now is to explain which is the right information, which is the wrong information. So that's the first point, is the technology for becoming educated is available. The second is, if we're managing chronic disease, let's say a patient with high blood pressure or with heart failure, where you want to know what their weight's doing or what their blood pressure's doing, you need communication. You don't have to have the patient in the office. What you need is the information. So you need to develop a system that allows the patients to report information in and get some feedback. That can be by telephone. Problem with telephone is you have to have both people there at the same time. It could be by internet-based tools, for example, that would allow a patient to send information about symptoms or blood pressure into the practice, and then the practice team could see that information and send information
and this
back.
This is where I see CardioSmart. I think our CardioSmart initiative, certainly, this has been a tremendous interest of mine for this year, has been the theme of my presidency, and the leadership of the college has put a lot of resources to improve our CardioSmart initiative, the website interaction between the caregiver as well as the patient, to gather this information and hopefully help improve this patient-centeredness, if you will.
Right, well, a couple of things. Number one, if there is information being transferred back and forth, then obviously we should probably capture that, because we can start to create registries of care from that and look at how we're doing in care management on chronic diseases. So that's one point. The other point is, as you know, we've been developing a patient education tool for cardiology practice waiting rooms, which is turning into a very interesting tool for, number one, the college being recognized as a key supporter of education for patients, and also a way to communicate with the patients through that tool.
The CardioSmart TV you're talking about?
That's
in addition
correct,
to
yeah,
tool.
right.
I think this is really a great area to capture not only education but ultimately engagement of patients and shared decision making, because I know we believe strongly that an educated patient is the most engaged patient, and I think it improves outcome, improves overall involvement of that individual. So I think this is really tremendous.
Yeah, I'll use the example of heart failure, where we've for years have used this term tailored care, where a lot of information is managed back and forth on the telephone, particularly weight, fluid balance, and so on. And there's good data showing that you can reduce hospitalizations, you can reduce morbidity from heart failure, for example, by this kind of patient-centered approach. And that's been around a long time. We've just given it a new name. And I think it's something that practices should embrace in cardiology because of this trend toward long-term chronic care for patients with heart disease.
And I want to take the opportunity to invite our members, our healthcare team, to look for a major revamp of our CardioSmart website. We already have tools nowadays for the healthcare team to engage with patients on tablets, on an iPad tablet called CardioSmart Explorer, and they could download that for educational purposes. But I think from a patient's perspective, CardioSmart version 2 will empower them not only in getting the educational information and the knowledge, but also it will be a website for them to enter most of their data, communicate it with their physicians and their care team, have communities, just like we have communities for CardioSmart on CardioSource, for the caregiver to understand what we're really giving at the same time. And all this really was gathered because of information that we've gathered from patients, from working groups, to see what would be best to enhance this relation between the caregiver, the physician, the healthcare team, and the patient, to empower them more and get them engaged in their health. So I think this is a tremendous area. The launch is for ACC 13, so in few months, and we will keep you updated as to what the new features would be. So we would really invite you, all of you, to join us with that. So with this, I want to thank you, Fred, for joining us today. We would like to invite you to visit CardioSmart community for the newest information and tools. Thank you again.
Thanks, Bill.